Hello everyone and welcome to another successful match experience. In this video, I'm very excited to have a discussion with Dr. Majd El-Harasis to talk about his experience matching at the world-renowned institution, the Mayo Clinic in Internal Medicine. Welcome Majd to the channel.
Thanks for having me.
Can we start by introducing yourself to the viewers about your journey and where are you right now?
Yeah, absolutely. So as you can probably already tell from my accent, I was actually born in the US. When I was 10, my family and I moved back to Jordan, which is where we're originally from. I completed the rest of my high school in Jordan. And then because I was in a British school in Jordan, I actually went to London to Imperial College London to study medicine there. And so I did a 6-year undergraduate program at Imperial. Graduated with a medical degree and also with a bachelor's degree in pharmacology. And throughout my time, both at medical school and shortly thereafter, when I was doing just foundation year training for 1 year, I had always known that, I wanted to transition back to the United States to complete my specialty training here. And which is kind of led me along the path of applying for residency, and here I am.
Awesome. And where did you match? What brought you to the US? One question people might ask, why did you come from UK to the US? Why didn't you do your residency in the UK? And what type of fellowship are you in now?
I think that's a very good question. And I think as someone who did time in the UK and then spent time in the US, I was able to compare and contrast the two different medical systems. The specialization program in the UK tends to be a bit of a longer specialization process, and you tend to have to change what you're doing at different points, meaning that you do 2 years of foundation training where you're rotating between different specialties. Then you go on to core medical training. And then after that, you go on to cardiology training. And the specialization process just takes a longer period of time compared to the US, where the specialization process seems to be a lot more streamlined. And one of the other benefits of the US system is that it seems to be a bit more, in my view, it just felt to be a lot more rigorous and kind of condensed in a short period of time. And I also really valued the fact that you are in a training program, you match to a training program, and you stay at that one hospital for a period of time, as opposed to the UK, where you can be matched to a particular region or an area, but that may mean that you have to move specialties constantly and sometimes move hospitals year to year. And so it didn't necessarily feel as though you were in one program for a period of time that allowed you to grow in that program and for the people in that program to know you. And so having kind of grown up in the US, I was very, very interested in coming back to the US, and particularly when I saw the advantages that the US medical system would offer me, that really enticed me further to come back to the US. And so I started my process of studying for my USMLE exams when I was a 4th and 5th year medical student. And during my final year of medical school, I had an opportunity to do 2 months of an elective or away rotation. And I came to the Mayo Clinic for 1 month, and I did another month at Beth Israel as part of Harvard Medical School. And I just had a phenomenal experience, an amazing experience. I remember rounding with the interns and with the other Mayo medical students and with the attendings, and just being struck by the rigor of the education, by how the residents had the autonomy to lead rounds and make decisions and be the doctor of the team, and how the educational program was just so well structured and rigorous. And it was something that really just, I think, resonated with me and made me realize that this is the kind of system that I want to train in. And so as part of that, I was able to get a letter of recommendation from both of those institutions. And Mayo was my first experience of US healthcare, and it was a fantastic place to be and to train. It was just, when I applied for residency, people, as corny as it sounds, will talk about a place where you just felt at home, or a place where, it's the right fit. And it just felt like it was a perfect fit for me. And I remember interviewing at other internal medicine programs and having my Mayo interview at the end. And when you interview at other programs, you sometimes get swayed a bit by like, oh, there are these aspects that are great and these aspects that are great at this program. And you start rethinking, perhaps I want to go somewhere else. But then when I did my Mayo interview, I was like, no, this is where I need to be. And so I ended up ranking it #1 and very happy that I did so.
That is an amazing experience. So I have many follow-up questions on these points you brought. The first one I get asked by many medical students, how do I find away rotation? So were you able to secure your electives at Mayo and at BID when you were a medical student?
So that's a very good question because the process for finding an elective rotation can sometimes be a bit difficult because it depends on what stage of training you're at. If you are a final year medical student, it's a bit different to say if you have already graduated and you are looking for an observership. The observerships tend to be a lot harder to come by because a lot of times you do need to reach out to people personally and arrange that, not necessarily through the medical school. The other issue is that there are a lot of different factors that you need to weigh and take into account when you are choosing an away rotation. Some programs will only take students from medical schools with which they are affiliated. Other programs will charge tuition fees, and some tuition fees can be thousands of dollars. Other programs require you to have done step 1. And so it's really important to, first of all, reach out, as I did, to my medical school, ask if they had any particular affiliations with any places in the US. My medical school at the time actually didn't have any affiliations with any places in the US. And so it required, just thinking about what geographical areas I wanted to be in and what places I could actually see myself doing a residency program in, because a lot of people think of an elective or an away rotation as not just an opportunity for you to learn and for you to gain contacts and letters of recommendation, but sometimes, if you do very well at an away rotation, they are more likely to offer you an interview and more likely to match you there. And so, people use the phrase that this is kind of like an audition rotation. And while I don't really like to use that, but oftentimes you hear a lot of stories where it was the case. And so I think it is important to weigh all those different factors into account. There are databases like the AAMC has a database where you can filter away rotations by geographic location, by whether they charge tuition fees, whether they accept international students who need a visa. So there are a number of restrictions, but it does kind of rely a lot on, where you see yourself going in the end, and some of the other considerations that I mentioned. The other thing that I think is a very valuable resource is just reach out to people who may be 1 or 2 years ahead of you, because they may know that this rotation is a great experience, or that they may have a contact at a certain rotations hospital that may give you kind of that foot in the door to allow you to do that rotation.
Wow, awesome. So, and I actually made a detailed video on how to find clinical rotations, both electives, observership, that the viewers can see in the cards above or the description below. Now I want to touch base on the USMLE Step scores. So these are considered by many IMGs as the only thing that matters. And we know they are not the only thing that matters, but they are important. So can you touch base about your experience with the USMLE exams, the value, how appreciated they were during your electives when you applied and during the match process?
Yeah, so that's a very good question. So Mayo required you to have done step 1 to do an elective there, whereas Harvard did not. And so again, that kind of, as I mentioned, limited, if you haven't done step 1, would limit where you're able to apply. The USMLE experience can certainly, as many as you would know and as many of the listeners would know, can be a pretty daunting experience. It is one that, particularly if you are studying at a medical school where the USMLE curriculum is not the formal curriculum and you have to do a lot of self-studying, people will use all the various resources that are online. And I actually have seen some of your excellent videos on all the different resources out there. That it can be a pretty daunting experience. For me, our medical school curriculum wasn't super aligned with the USMLE. It taught us what they felt was necessary to be a good doctor, and that may not necessarily involve the glycogen storage disorders in as much detail as step one wanted you to know. So there was a lot of self-studying involved, but the most important thing is to choose your resources wisely and stick to those resources rather than spreading yourself too thin with a million different resources. I find that that was something that was incredibly valuable to me. I know that we're kind of heading in an area now where the step one score is no longer going to matter. Back when I applied, the step one score was kind of like the thing that everyone talked about. And it was like your golden ticket of like, if you do well on step one, that kind of will guarantee your future. I was fortunate enough to have done well on step one. I got a 260 on step one. And so that was a pretty good score that allowed me to be competitive when I applied for internal medicine. And I think that it did certainly help in the sense that perhaps it granted me more interviews and things like that. But I also know of people who were successful at lower step scores that had kind of worked on other aspects of their application, which I'm happy to talk about as well.
Awesome. So what do you think is the good score for people to match if they didn't get to 60? What do you think, is 250 good enough? Is 240 good enough? From your experience with Mayo and other programs, do they have cutoffs? What is the safe score?
Yeah, that's also a very good question. So I know that programs have cutoffs for reviewing applications. And I think that that tends to filter if you scored below a certain point that they may not necessarily look at your application, but usually that's a pretty low score. In general, I find that you basically just want to ensure that you score as high as you possibly can. I have recently moved away from giving people an exact number of what to aim for because I have heard of people who have been successful at matching at good university programs with scores in the 230s or 240s. And, previously I had been told, and the advice that people had been told, that if you want to match to a top tier university program that you need to score above X. I'm not really sure that that applies anymore. I think the advice that I give people now is that the higher your score is, you want to aim to score as high as possible, but the higher your score is, the easier you make it on yourself and the more likely you are to get electives and interviews, because that does, whether we like it or not, allow the programs to have an objective measure of how much clinical knowledge you actually know. Because there's no way that these medical schools and these programs can compare what an A+ means in one medical school in the UK compared to the Middle East, where my family's from, compared to, East Asia. Like there's just no way that you can compare and contrast what that means. And so the STEP score allows them to have that objective measure. And so I say the higher, the better. And I really do think that one of the things that may actually happen as a result of the STEP scores becoming pass-fail is that people may not necessarily study as. And one of the things that I am very happy for is that because, and even though it made it more stressful, because I knew that I had to score as high as I possibly could, I mean, as you did, really studied those books a million times and went through it 1,000 times and made sure I knew as much as I could cold before I walked into that test. And when I compare it to like my internal medicine board exam, which was a pass-fail exam, and how much effort I put into that, I can tell you it was like night and day. And so I do think that it's important for people to A, score as possibly can, but B, remember that we are learning this so that you can become a good doctor. And while some people may say that, like, how is the Krebs cycle going to help me become a good doctor? But understanding the fundamental principles of medicine and learning all that foundational stuff well will serve you very, very well for years to pass. And so you may think that it's ridiculous and it's silly and it's like never going to be useful clinically, and some of it is, but I really do value the fact that I was able to delve into the material as much as I was able to, because I knew that I had to study it so well to get a good score.
I totally agree with what you said, because when you have the stress of an exam, the useful stress, there is this curve that shows you if you're not stressed at all or stressed too much, it would be harmful. You're stressed the good level, it would help you to study more, because if pass fail, you won't study enough, and that would have two consequences. First, on your medical knowledge, as you mentioned, but also on your step 2 CK score, because previously we used to prepare for step 1 very well, and when you go to step 2, it's easy. Now we already know a lot of info from step one. But now I think the transition is going to be to the score of step two is going to be the alternative step one. And now people did not study well for step one and they might not score as well on step two. And this is the point that you mentioned is also something I always advise people is try to get as high score as possible. But the only downside of the high score is don't spend years studying the exam. So of course, if you want to study more, you will get higher score, but comes the time with that and people just spending years after graduating to study and not do research and other stuff. So what is your comment about the duration of study and how long should somebody study?
That's an excellent question. What I tell people is know where you're at and set a date. Set a date that you are going to take this exam on this day. I remember that I probably spent a year before I started studying seriously for step one, as many people that I've spoke to also did, having the books there, maybe studying a bit, and then getting distracted with other things. But when I actually went through the process of printing out the form and paying the money and setting a date, that was a real kick up the butt to be like, it's time to start studying. And this is it. And I've spent the money. Let's go. So what I tell people is have a target score in your mind, depending on what you want to specialize in or what you just see for yourself. For me, my target score was 250 plus. I was like, I want to get above 250. That's a safe score. That was my target score. And what I had said to myself was, if I feel like I cannot attain that because you only have one shot at step one if you pass, and if based on the NBMEs, which are highly predictive, and for me, they predicted the two NBMEs that I did, both for step one and step two CK the week before the test, predicted my score exactly. And so if you are in the range where you want to be with your NBMEs, and in terms of your studying, because you're never going to feel 100% confident with all the material. There's always stuff that you're going to forget. There's always stuff that you're not going to feel confident with. So you're never going to get to a point where you're like, I can recite first aid front to back off the top of my head. That's never going to happen. But you want to get to a point where you're like, if you are at the point where you are ready and your NBME scores are within your target, then you need to take the test. You should only delay it if something comes up or if you have consistent proof that you are not quite where you need to be. And that is the only time to delay it. But to delay the test to up your score from like 250 to 270, I'm not sure how much benefit that reaps. And if anything, as you mentioned, you're putting your life on hold. So other stuff, your clinical experience, your research, all of that stuff will end up taking a backseat. And so in terms of the duration of studying, that's also a very, very common question. And it's one of those situations where it kind of depends on how much free time you have to allocate to studying. If you are off, like I basically studied for the test seriously, I would say for about 6 months. But the first 4 months of that, I was on clinical rotation. And so I would be going to the hospital, coming home. I would have other assignments and tests to study for. And so that was kind of on the side and on the weekend. But then I had an easier rotation, and I specifically chose my rotation schedule to have an easy rotation before step one, because I was able to kind of have half days here and there and devote more time. And then I had a dedicated study block of 3 to 4 weeks where I was studying the entire day. And so other people may not have that luxury. Some people may have more free time, and have months where they can dedicate to it. So it really depends on what your baseline is and how much free time you have to devote for it. Certainly, it's not something that you can just crank out in a few weeks, I think, even if it's being pass-fail. I think it's definitely something on the order of months, and so I think like serious studying, like 6 months is a good kind of bench point to have in your head, but it really just does depend, as I mentioned, on all the things that I mentioned.
Definitely, because you see some people say, oh, I studied step one in 4 weeks or 8 weeks. They mean they dedicated only studying for step one. For example, American medical students, they have 2 years to study the materials of step one. So they've been reading first aid and UWL, and then they took 4 weeks or 8 weeks off to fully study step one. So don't confuse this for 8 weeks with you just starting and studying 4 weeks and passing the exam. That was an extremely insightful discussion about the STEP exams. Now I want to move on to the things that you did after you graduated. So you said you did electives when you were a medical student. After you graduated, what the path you took until you matched in residency?
Yeah, so I applied for what they call in the UK foundation training, which is kind of the first step that everyone takes after medical school. Everyone does 2 years of foundation training, and you basically do 4-month rotations in different specialties. You are not matched to a certain specialty, so it's general training. So I did 4 months of general surgery, I did 4 months of cardiology, other people did psych, just whatever. And so I was working at a hospital in the UK, knowing that like I started my job in August, that in September I was submitting my ARIS application to apply to residency. And so that was kind of like a buffer and a transition for me because it was pretty easy to apply to in the UK. Foundation training doesn't require an interview. It doesn't require a personal statement or letter or any of the other stuff that we have to do for ARIS. It's basically a situation of pretty much filling out an online form and doing an extra 2-hour test, which you really study for, called the situational judgment test. And then basically getting allocated to a hospital. And it was great for me because it provided income, as little as that income was, but it still allowed me to be able to cover my rent and expenses and all of that stuff. But also it allowed me to stay within clinical medicine. And your first few months as a doctor are challenging wherever you are. When you make that transition from like sheltered medical student to doctor, and suddenly you're the one prescribing, you're the one assessing a sick patient, by yourself. That transition made it a lot easier when I started intern year in the US, because those firsts I had already had. My first time assessing a patient with chest pain, or my first time being called to because someone was desaturating, or my first time, prescribing antibiotics, like when they actually as they did in those days, hand us a drug chart and you have to write out the dose. So that made the transition a lot easier. Certainly it was something that I felt well supported in doing. My supervisors knew that I was applying for residency and that I was going, for interviews. It did mean that, I had to be more deliberate about where I interviewed at, and had to consolidate all my interviews in like 2 1-week stretches, which can be a challenge because sometimes, you're not given a huge choice of dates. But thankfully, I made it work, and I look back at that time really fondly, and I think it provided me with a lot of really useful skills that I still use today.
Wow, that's awesome. So from September until the residency in the US in July, you were doing residency in the UK.
So I was working in the hospital. I will say that I did quit on May 1st. And the reason I quit was I found out that I matched in mid-March, and I was allowed through my job to resign with a 2 weeks notice. I ended up working for an extra 6 weeks just to give them a bit more of a buffer to find someone to replace me, because UK hospitals are pretty busy. But the one thing to note about the UK training system is that when you graduate from medical school, you are only provisionally registered with the General Medical Council. At least that's how it was at the time. And you only get fully registered as a doctor with the General Medical Council when you do your first year, which ends on August 1st. And that wouldn't have worked with me for residency because, as you know, orientation often starts in mid-June. And so there was no way that I would have been able to complete that full year. So I knew that I wasn't going to get GMC registration or any other kind of certificate from, staying longer versus staying earlier. And so that's why I chose to take that month off. I went back to Jordan, spent time with my family, and just got my stuff ready to come to the US to start residency here.
Awesome. I've seen so many IMGs who wanted to match at Mayo or other institutions. They do research because they didn't have that option of clinical training to cover that gap from the time of application to match. From your friends, colleagues, what is the experience of that? Does that help? And what is the number of publications they should have?
So that's a good question as well. I think that it ultimately depends on what opportunities you get and what opportunities you've had. Certainly, if I did not do a research year, and there's some people who have been very successful, as you have been, and other people who, matched without one. So I wouldn't say that like doing a research year is an absolute requirement. And I think that in some cases, doing a research year may actually be not feasible for some people because a lot of these positions may be unpaid. And so for people, it's like a big personal expense on them and on their family to do a research year. And so I think that if you have a good opportunity to do a research year, and certainly if it's paid and if it's something that you're interested in, maybe, I've heard of some trainees who have gotten a research position basically through their elective where they're working with an attending and the attending is like, hey, I'm looking for someone to like do this research with me. And that's how that was facilitated. So certainly if that was the case, and if it's somewhere that you see yourself potentially practicing in the future and you have a good mentor, then I think, being a research trainee has a lot of advantages. It really spruces up your application and it gives you a lot of, good insight into academics and gives you publications and things that are really, really valuable for your application. It provides you with connections because a lot of these mentors, as you have seen, will know people across the country and can actually facilitate getting you, whether it's an interview or other things here and there. And then the other thing is that being a research fellow, I think, gives you a bit more flexibility when it comes to applying and interviewing than, say, if you're working as an intern in another country. And so I think that there are certainly a lot of advantages and disadvantages to doing that. Regarding whether or not how many publications you actually need, that's a question that I get asked very, very commonly. I was fortunate to have had the opportunity to do research during medical school. But I also know for a fact that that is not the case for a lot of people. And I think in particular to Jordan, just because, my family lives there and I know a lot of people who studied there, they don't really have a lot of opportunities to do research during medical school. Some of the more motivated medical students, and again, it kind of ends up being ad hoc, you may get a case report published or, something interesting like that, or maybe do a small project. But, there aren't as many robust opportunities for research as there are in the US and in the UK. And so I was fortunate in that I spent a summer in the UK, working in a lab and doing research. And I also, as part of my bachelor's degree, which was a requirement of our course, spent 10 weeks in a lab doing research, in addition to other clinical projects that I had done here and there. So when I applied to residency, I had 5 publications, not all first author. Yet, so I was an author on 5 peer-reviewed publications. And I think that that helped. The most important thing that people have told me, including previous program directors, is what they want to demonstrate and see is a commitment to academics. And they want to see that you are able to start a project, do the research, and get it through. Whether even if it's just as a manuscript that you've submitted, that is something that shows up on your ERAS. Like, you don't need to have it as a full-fledged in-print publication for you to get credit for it. Even having a manuscript in submission or in process demonstrates to people that you have the ability to take on a research project, do the analysis, write it up, and get it to a point where it is ready for submission. And I think that in and of itself is valuable. What I tell people is whatever opportunities you get, just take advantage of them. And I know that sounds really corny and cliche, but like, whether it's a case report, whether it's a systematic review, whether it's, helping people with fellows with an ongoing project where you can get your name in print, you may just help them with like writing it up or doing the analysis or chart review. Whatever opportunities you have available, just go for it. And I think you'd be surprised at how many people actually have more research projects than they can actually complete and actually need help. So don't be scared. I love it when people come to me and they're just like, hey, like, do you have any research projects like that I can help with? And I'm like, yes, like, there's just so many that I need help with, especially like medical students and residents. And if I don't, like, there's no harm. Like, I can just tell you, I don't, but this person would be a great person to talk to. So you would be surprised, since most medical places now have a requirement for their trainees to undergo some sort of scholarly activity. There's always research to be done, and there's always people who need help. So whatever opportunities you can get, just go ahead and take advantage of them, and just do whatever you can to kind of spruce up your CV to get it to a spot where it can make you a competitive applicant.
Awesome. My final question for today is, throughout my experience, I felt that medical students from Canada, medical students from UK are highly regarded compared to other medical schools around the world. So what is your thoughts on that? And if somebody is listening to us from other countries, what do they need to do differently or more in order to maybe match at Mayo or other top tier residency programs?
Yeah, it's kind of an unfortunate process where I have met medical students and trainees from very small medical schools in very small countries that, do not have anywhere near the resources that are available at US medical schools. And they are, by and large, better doctors than a lot of people who have trained here. And so, but unfortunately, the medical process here will still favor people who are American graduates, who are graduates in certain countries, whether it's Canada or, Australia or the UK. More so because I think they feel that the curriculum there probably is a bit closer aligned to the curriculum in the US, and that they can kind of guarantee that there is a certain degree of rigor and a certain degree of knowledge base that is required at those institutions. And so I think from a programmatic perspective, you can kind of understand why they may sometimes gravitate towards that. But I will say that that is not the case for in terms of having a successful match. I have met people from UK medical schools who have not been successful in matching in the US. And I have met people from medical schools all over the world who have matched at top tier prestigious institutions. The more important thing, honestly, is how hard you work, how high you score, what your CV looks like, and how you present yourself on your rotations, whether it's your elective rotations, whether it's during a research year that you're taking, whether it's, on the interview. Those are the things that I think matter more than anything. Because at the end of the day, when we're done with training and when we're all attendings, people don't really look at, where you went to medical school. It ends up being, where did you do your residency? Where did you do your fellowship? And so the playing field levels out substantially. So I don't want people to come away with hearing that, you must have done X amount of publications or graduated from this medical school in this country in order to have a chance in the US. This was my story. But I also know a lot of people who may not necessarily have had some of the opportunities that I had, but still, worked incredibly hard and matched up places that are even better than, where I matched. And so it really just depends on how hard you work and what you put into it.
I totally agree with that. And I can tell you from my personal experience, I interviewed at top tier plastic surgery residency programs coming from Syria. So there might be an institution here and there that would not accept IMGs from Syria or not accept IMGs from India. That is fine. There are 100 or 200 other institutions that will accept you. So
their loss.
Awesome. That was an extremely insightful discussion, Majd. Do you have any final thoughts about this topic or any final advice you would like to give to future medical students applying to internal medicine?
Yeah. What I will say is, just continue to work hard and just don't hesitate to reach out to people, whether it's at the institutions that you're interested in. And just remember that what I tell people is just reach out once, send a polite email. If people reply to you, that's great. You never know. Sometimes people will be like, yeah, sure, absolutely. And they'll help facilitate stuff. The worst case scenario is people don't reply. And, we have all been through this. We know how tough it is. And so if you have any questions at all, please don't hesitate to contact us. And we love to pass it forward and see other people succeed. And so just keep on doing what you're doing and good luck with everything.
Thank you so much, Majd, for sharing your experience. It was a pleasure having you on the channel. For our viewers, if you have any questions, make sure to leave them in the comments below, or feel free to reach out to me on Instagram or Twitter at Malki Assad, or my Facebook page, Malki Assad MD. You You can also have a look at my website, in which I offer tutoring for USMLE aspirants, for those who are applying to residency, or if you need any help with interview preparation, CV, or personal statement. For those interested in research, make sure to check my research course, in which I provide you with the information and the skills that you need to take a research project from an idea to publication. If you find any value in this video, make sure to hit the like button, subscribe to the channel, and hit the bell sign so you get notified whenever I post future videos on my YouTube channel. Thank you everyone so much for watching, and see you in future videos. Peace.